Dr. Anamika Chaudhary.
Good afternoon, everyone present here. Myself, Dr. Anamika Chaudhary. I am here to present on ocular manifestations and visual field patterns in traumatic injury and stroke patients. Traumatic brain injury and stroke are major causes of death and disability around the world. Large portion of the central nervous system is dedicated to vision, and therefore strokes and TBI have a high likelihood of involving vision in some way or the other. Vascular occlusion along the efferent or the efferent visual pathways can produce myriad effects, including transient monocular vision loss, visual field deficits, and ocular dysmotilities as well. So, in this present research, we analyzed and compared the ocular manifestations and VF patterns in cases of TBI and stroke patients. The aim of my study is to study the ocular manifestations and visual field patterns in traumatic brain injury and stroke patients attending Tertiary Care Center of Jharkhand. It's a retrospective cross-sectional study which included 118 patients with TBI and stroke. The patients with brain injury due to trauma and stroke admitted at our hospitals were included in the study, and the patients with very low general conditions aged less than 18 years and other corneal morbidities were excluded. Patients underwent comprehensive ocular examination, systemic examination, CT scan, and fundus examination also. Standard automated perimetry with central 24-2 threshold test was done. Analysis of demographics, clinical features, and VF results were conducted as well. So the results, we saw that 33.89% patients had been diagnosed with TBI and 66.1% with stroke. The etiology of the TBI showed that traumatic road traffic accident was the major cause in traumatic brain injury patients, followed by self-fall and others. The types of TBI ranged from subdural hematoma to subarachnoid hemorrhage, extradural hemorrhage, intracranial hemorrhage, diffuse axonal injury, and intraventricular hemorrhage as well. The demographics were compared, and we saw that patients in the stroke were of a higher age group in comparison to that of traumatic brain injury patients. Both hypertension and diabetes were more fondly associated with stroke in comparison to traumatic brain injury patients. The clinical features were compared and seen. Here are some photographs which we have taken during the process. The fundus abnormalities were detected, which were classified into glaucoma suspect, diabetic retinopathy, drusense, vitreous hemorrhage, and optic disc pallor. Coming to the VF defects, we saw that homonymous hemianopia was found to be more commonly associated with stroke, that was in 31.8% cases, in comparison to 14.4% cases of traumatic brain injury. Homonymous quadrianopia was also seen in 12% cases of stroke and 11% of that of TBI. Scattered defect was more common in traumatic brain injury patient, which was 56.5%. Here are some visual field photographs. So, coming to the discussion part, the ocular manifestations of TBI and stroke in our cohort are in line with the previous reports of various structural and functional abnormalities. With respect to the present VF defect patterns in TBI, the scattered pattern was the most common, which is inconsistent with the previous study. Visual dysfunction is frequently overlooked and or underestimated in TBI and stroke cases, as the primary focus is often on diagnosing and managing life-threatening systemic conditions. However, visual deficits can significantly impact patients' daily life and negatively affect their rehabilitation and quality of life as well. Therefore, it is crucial to accurately evaluate and rehabilitate visual functions in addition to addressing the physical losses which these patients face. So we concluded that numerous eye-related symptoms are observed, with a significant number of patients experiencing visual field defects and demonstrating unreliable VF test results. Our research highlights the importance of carefully assessing and rehabilitating visual functions in both traumatic brain injury and stroke patients. Beyond addressing systemic health issues, prioritizing visual well-being should also be a central focus in their overall care. Here are some of my references. Thank you.
What was the incidence of squint diplopia and ophthalmoplegia and papilledema?
So papilledema was more common in traumatic brain injury patients, and squint was also more common in traumatic brain injury patient because of the nerve entrapments due to fracture of the orbital floor and other.
What was the pattern of the field defects? Was it altitudinal?
Yes, sir. We saw quadranopia in some cases of traumatic brain injury.
That's right.
What's the one sign that you would look for? What's the first thing that you would want to look for in these kind of patients?
Ma'am, usually these patients are referred to us from the neuro surgery departments or the medicine departments. So mostly they are sent for fundus examinations. So the first thing which we do is first anterior segment examination and then the fundus examination. So then according to the fundus examination, we suggest the various other tests.
Probably ma'am is telling about the coma score, I think.
What about the pupil?
Yes, ma'am. Pupil also anterior segment examination.
A pupillary reaction is.
Yes, ma'am. That was checked. That was checked.
Related to afferent pupillary defect.
Yes, sir. Yes, sir. That was checked and compared.
Thank you.
Very good.